Friday night, we begin with a flurry of major developments in the COVID pandemic from coast to coast. California's governor made a monumental announcement today requiring COVID vaccines for all school kids from kindergarten to 12th grade once vaccines for kids are fully approved by the federal government. Well, tonight, as the U.S. nears 700,000 deaths from the coronavirus, the U.S. drug company Merck says it has developed a new pill that could be a game changer when it comes to treating coronavirus. Merck is now planning to seek emergency use authorization from the FDA for the world's first antiviral pill to treat COVID. And there's breaking news in New York City, where a group of public school teachers asked the Supreme Court to block a vaccine mandate that's set to kick in today. CBS's Nikki Batiste is in the Big Apple right now to lead off our coverage. Good evening, Nikki.
Nora, good evening. Here in New York City, the deadline is just passed for all public school staff to get at least one vaccine dose or face termination. And we just learned the Supreme Court has refused to block that mandate. And today, another mandate in California. All eligible school-age children must be vaccinated against COVID as soon as the FDA gives full approval for the shot.
We want to end this pandemic.
California Governor Gavin Newsom took a bold step today, making his state the first to mandate COVID vaccinations for eligible children in public and private schools once the vaccine is approved by the FDA.
In fact, I anticipate other states to follow suit as well.
The vaccine will be added to the list of other vaccinations like measles and chickenpox required by schools in California. About a third of California kids 12 to 17 are not vaccinated against COVID.
I'm 100% in favor of it.
Meanwhile, today, drug company Merck announced its experimental pill, molnupiravir, could be a game changer to treat COVID.
This is quite impactful data that we hope offers a little ray of hope during this dark time of the pandemic.
In the trial, patients with mild to moderate COVID at risk for serious illness were given treatment over 5 days. Data showed it reduced the risk of hospitalization by 50% with no deaths. There were 8 deaths in the group given a placebo. The results were so promising, the trial stopped recruiting participants, and the company is now racing to file an emergency use authorization with the FDA. Nationwide, cases of COVID continue to decline after the summer surge, but 56-year-old Supreme Court Justice Brett Kavanaugh didn't escape its reach, testing positive for COVID. The fully vaccinated justice is asymptomatic, but likely won't be on the bench when the new term starts on Monday. And in New York City tonight, the deadline for all school employees to get at least one shot has passed. About 20% of nearly 4,600 school safety agents still have not been vaccinated against COVID and will not be eligible to work Monday. Hundreds could be forced to take unpaid leave or lose their jobs.
Do you think schools will be less safe on Monday?
Schools will definitely be less safe on Monday because you have less school safety agents.
I can't afford to live on the streets. I need money to take care of my bills.
The threat of losing her job pushed school cafeteria worker Allison Boston to get her first dose this week reluctantly.
Now that you have a vaccine dose, do you feel safer going into school?
Yes. Honestly, yes.
We learned today an FDA advisory committee is meeting on October 26 to discuss a vaccine for younger kids, a positive development for the prospect of shots being available for kids ages 5 to 11 around Halloween. Nora?
All right, Nikki Batiste, thank you.